Hello and welcome back to my channel. This is Amanda Dewald, wife and mama of 2 boys, pregnant with our 3rd. If you are returning, thank you for joining on this journey. If you're brand new, thank you so much. Make sure you click the like and subscribe button so you can follow along. Oh, I never look up the date. I'm so terrible. Today is Saturday, July 25th, I believe. Yes. Today is Saturday, July 25th, and I am currently 22 weeks and 2 days pregnant. This video is going to be all about week 21. So in week 21, I'm going to cover, I had a midwife appointment. I had the appointment finally with the pelvic floor therapist, which if you're not familiar, I've been talking about in previous videos. I've been having a lot of pelvic pain this pregnancy, so I had an appointment with a pelvic floor therapist. And then I'm going to talk about some symptoms for week 21, I'm sorry, as well. Things that I have noticed for week 21 are, number 1, my appetite. I am hungry all the time, and if I don't get food, it's no bueno. I can be a pretty hangry person, like in general, and being pregnant and if I'm hungry, it's just a bad combination. So I constantly have like granola bars and things like in my purse or wherever that I can just snack on. I've been really enjoying like hard boiling eggs so that I can just have like a quick protein snack, doing shakes, things like that, like in between meals. Another thing that I've noticed is my boobs are huge. There's just no way else to like put it. But they are like popping out of my bras, which I know I mentioned in a couple of videos ago, but they're like really, they just keep getting bigger. So I am at the point now where like I really need to get some new bras, and I'm debating I think my cat just was making some noise. I'm debating, like at 22 weeks pregnant, do I buy regular bras in a bigger size, which will probably not fit afterward, or do I just go right into nursing bras, which I'm kind of thinking probably nursing bras. So it has been, gosh, my youngest is 5 and I breastfed him until he was almost 2. So it's been like 3 years since I've breastfed. I obviously don't have any of my nursing bras anymore. So if you guys have a favorite brand that you love or any suggestions on which ones I should get, please drop them in the comments below, please and thank you. I'll probably ask over on my social media page as well. But yes, so the appetite, the boobs, and then just the pelvic pain and pressure has kind of continued. But I will say, since I've had my first appointment with the pelvic floor therapist, it has seemed to be better. It's still there, but it's more sporadic throughout the day than it is like constant, which is weird because she didn't really do like a ton at the first appointment, but I don't know why, it is seeming to get a little bit better. So we'll see as far as that goes. All right, so those were pretty much the only symptoms I really had this week. Honestly, I feel great. I feel so amazing. People keep asking me, how do you feel? And I'm like, I feel fabulous. So I also had a midwife appointment. And so at my midwife appointment, I met one of the other midwives, which was nice because I had never met her before, and she was so lovely. I loved it. She was very kind, very attentive, asked me a lot of questions, which was really reassuring. So the baby's heart rate was 150 beats per minute, roughly. We discussed the pelvic pain and pressure, and she didn't say I have anything to be concerned about, but she said just basically she let me know, you know, if you're feeling anything that's not normal, you can always call us. It doesn't matter if it's the day or night, whatever, like we are here for that. She said the fact that I've been getting the pressure plus the pain plus losing parts of my mucus plug are slightly concerning, but she said like you know, I think I mentioned it in my last video, when they did the sonogram, they measured my cervix and it was like above normal for like length or whatever, and no bleeding, no cramping, like nothing like that. So nothing to be like overly concerned about, but she said just keep an eye on things, and if I experience anything out of the ordinary to please call. So I've been taking note and making sure that I'm drinking lots of fluid and getting lots of rest and all of the above. We also talked about the glucose test that I will need to take at 28 weeks, so that'll be coming up in about 6 weeks. We also discussed birth options again. She asked me, you know, if we were going to be doing like a home birth, or if we were going to be doing the home birth at the practice where they have 2 birthing rooms. And so I told her, as of right now, we can always change our mind, but as of right now, we are planning on birthing at the midwife's house, which is what we did with our last pregnancy as well, and we really liked that option. We also discussed the option of a doula again, and honestly, like, I love doulas. I think that they're incredible, and I think that they are very, very valuable, really valuable. We had a doula with our last pregnancy. This time around, I just don't feel like it's 100% necessary, given that this is my 3rd baby, 2nd home birth. My husband is extremely supportive, and I've had 2 of the midwives now agree with me, say that like they don't really feel like it's necessary. It's obviously great and wonderful if I choose to, but it's not something necessary. And we have just had so many life things going on with buying the house and, you know, other things, other little projects that we have going on, that I think we're probably going to skip it for this pregnancy. So we'll see how everything turns out. But if you're like debating on getting a doula, if it's your first pregnancy, I would say 100% get one. If you're planning a hospital birth, 100% get one, because they're so valuable for helping to advocate for you in the hospital. If it is your first time with a home birth, I would say definitely get one. My sister just had her first baby a month ago, and she had a doula, and she said that it was like the best money she ever spent throughout her pregnancy. She said she was extremely valuable. They felt like they got more information from her than they did from her midwife. Obviously every doula is different, but I would recommend looking into getting a doula. Okay, so that was pretty much what we talked about at the midwife appointment. It was fairly quick, fairly simple, but it was nice. And the baby is measuring like right on track for my due date. Next and last, I want to talk about the pelvic floor appointment. So I had never heard of a pelvic floor therapist until recently, like within the last year, maybe 2 years. I had started following a few of them on Instagram, and I just thought it was really interesting. And then when I got pregnant and was having the pelvic pain, I talked to my midwife and my chiropractor about it, and they both recommended that I make an appointment with one. So I did, and she came last Saturday, so it was exactly a week ago. And it was great. She was wonderful. She came right to my house, which was amazing. I didn't have to go anywhere. And we talked for a while. She was here for over an hour. We talked very extensively through my history. So like my first pregnancy, my second pregnancy, my childhood, like all of this stuff. So I really felt like I was, and obviously everyone is gonna vary and be different. If you're in my area and you're looking for one, let me know. I can DM you and tell you who it was that I went to. But I felt very like heard, and like she was listening and actually trying to figure out like root cause of problem. That's very important to me, is like not treating symptoms and finding root cause of the problem so that we can actually fix it and move on. Then we talked about my symptoms. She did say that, so she's pretty sure that it is pubic symphysis diastasis, I believe. But she said it is presenting oddly because it's mostly just like on my right side. However, when she would like press in the middle, which is where it is, that like pelvic bone that comes together, it was very tender and sore. So she said she's pretty sure that that's what it is, which is what my chiropractor thought it was, and my midwife as well. And she said that it could just be it's like so tight on one side that it's like pulling, and or it could be referred pain. And so she said once we do like an internal exam, which she did do, she said I'll be able to tell more. But she said she's never seen that presented that way, so if it's not something that she can help, then she may have to refer me to someone else, which I also respected because she was upfront and honest with me right from the beginning. And then she did an internal exam, which was, I won't lie, kind of awkward and weird, especially because it was like in my home, like on my couch, like not in a doctor's office or anything. But she was very good at like making me feel comfortable. So after she did took the history, looked at the symptoms, did the internal exam, she determined that she believes it's the pubic diastasis symphysis, or maybe I messed that up now. I don't know. I'll put it somewhere up here for you. I think I said that backwards. And she also said that I am very like tight down there, like overly tight, like too tight. And so she said that basically matched like all my symptoms. She could tell by like her exam that she did, and she thinks that that is causing the pain. So if you watched one of my other videos when I talked about how my husband kept telling me to do Kegels and I don't like doing Kegels, she told me do not do Kegels, because if you remember in another video too, I talked about how I was having an issue where when I would sneeze, some pee would come out. Super embarrassing and annoying. And so I did mention that to her, and she said that don't do Kegels. It's the opposite of what you want when you're tight. If it's loose, obviously Kegels are fabulous and you should do them, but that's not always the case. So she said no Kegels. She actually taught me how to do a reverse Kegel. So I'm supposed to be doing that. Excuse me. I'm also supposed to be doing, I just purchased their myofascial release balls, so you can just buy them off like Amazon or whatever. And I am using that to like massage like the upper part of my thigh, like where it meets like my pubic bone kind of. She also recommended I get, bending over is getting so much more tough. I keep just doing these things and I forget that my belly's here and I'm like, oh, that's hard. She did recommend that I get a like support belt, a pregnancy support belt. So I just ordered this off Amazon. I want to say it was like $20-ish, maybe $25. So I haven't worn it yet, but she recommended not to wear it every day, and to wear it only for like an hour or two, like maybe once or twice a day, preferably. Like she said, if you tend to be in pain like at night or at a certain time throughout the day, wear it like the hour before that or whatever. So I haven't used it yet. I just got it in the mail. But if I'm having a rough day and in a lot of pain, I will be using this. Plus when my belly gets bigger, it will be helpful. She also gave me some different exercises, like a certain kind of squat to do, basically keeping my hips neutral. So I don't want them like too close or too far away. And then also icing, which she said to check with my midwife first, just to make sure like that it will be fine for the baby to put ice on it. But she said it's really not near the baby. It's more like down here is where it needs to go, because like all of these muscles and tendons in here are all very tight, like inside and all around this outside area is just very, very tight. So that was basically the list of stuff she gave me to do. And so I will be doing that, and then I have a follow-up appointment with her in a couple weeks, so we'll see how all of that goes. But that was pretty much my week 21. It mostly consisted of the pelvic floor therapy, the midwife appointment, and then just a few random symptoms, but overall I'm feeling really, really good, which is awesome. So let me know in the comments below what symptoms you're feeling at week 21 so that other mamas can see. So feel free to put those down below. Now I am going to give you a belly shot. Again, remember that this belly is a 22-week and 2-day belly. And again, I feel like I'm just a broken record, but in case for people who don't watch all of the videos, my belly is super pale, okay? So just prepare yourself. All right, so here is my I'll move this. Actually, I'll just take this right off so you guys can see better. This is my, look at it, really popped, you guys. My 22 week and 2-day belly. And actually today was the first day I had a complete stranger ask me about my pregnancy. So I was like, well, I know I'm definitely showing and definitely look pregnant because I had no idea who she was. We were just at the store actually today. And I had my 2 boys with me and she goes, are you having a girl this time? Which, you know, it's kind of a weird thing to say, but I totally understand. So here's the belly without the shirt. Oh, look at, you can see all these veins. Ooh, creepy. Front view and side view. And that is the belly. And I will say, as far as weight gain goes, I have, I'm so bad with math in my head, so I'll just say it and I'll write it up here somewhere so that you can see for reference. But I started off at 123 pounds and I now weigh 138. So whatever that is, I'll do the math and put it up here, is how many pounds I've gained so far. And again, I am currently 22 weeks and 2 days. Thank you so much for tuning in to this week 21 video. I will see you guys next week. Thank you, thank you, thank you. Make sure you like and subscribe, and I will see you soon. Bye, guys.